and we want to talk a bit more about that. But before we do, let's talk about India and the healthcare system. For those of us that are not really aware, how does the Indian healthcare system actually work compared to somewhere like the UK?
So let me put things in the right perspective. The healthcare is the biggest industry globally with a size of more than $10 trillion. And US healthcare industry is almost $3 trillion size. They spend almost 18% of their GDP on healthcare. Back home in India, we have almost the healthcare industry size of $160 to $180 billion. The size of the industry is likely to increase to $372 billion by 2025. India is one of the fastest growing economies. It's a $3.2 trillion economy today. Unfortunately, our spend on healthcare is less than 5%, 4.7% to be precise. Of that, the government spends just about 1.15%, and the rest of the expenditure comes from the private players. In India, the healthcare penetration, insurance penetration is very low. It is less than 25% vis-a-vis the advanced healthcare markets, which are more than 90%. The out-of-pocket expenditure on healthcare is very high as a result. It's almost close to 70% in India. The per capita expenditure is very low. We have a lot of challenges with respect to the infrastructure in India. 70% of the country resides in rural areas, whereas the healthcare delivery in the bigger cities is almost twice as much as that in the rural areas or tier 3, 4 towns. So really speaking today, the challenge lies in taking healthcare to the last mile. Recently, the government of India came up with a path-breaking initiative called as Ayushman Bharat, which promises to cover almost 500 million people. So in a country of 1.38 billion people, almost 500 million are likely to be covered through this scheme. And this scheme would also form the base for universal health coverage in the coming years. And gradually, we are also inching towards value-based care, what is already prevailing in some of the advanced economies. So we have a very robust system of accreditation. Some of the hospitals which are being empaneled for Ayushman Bharat would be NABH accredited, which is the gold standard in terms of quality in the country. There are close to 1,000 hospitals already which are NABH accredited in India. We also have JCI accredited hospitals, close to 30 plus, but in due course of time more would come up. So the government is going to patronize the hospitals which offer very high quality treatment at affordable costs, which is safe and accessible. Unfortunately, today, the challenge is in taking the healthcare delivery to the rural areas. And as part of that initiative, the government is going to increase its expenditure on healthcare from the current 1.15% to almost 2.5% by 2025. As you are aware, India is the fifth largest economy in terms of PPP. We are third, but our healthcare expenditure and other indicators currently are abysmal. We currently have almost 2 million beds in the country, almost a million short of what is desirable. We have almost shortage of 2 million nurses, almost a million beds, and a large number of other infrastructural and manpower related shortages, which we need to bridge in, in the interest of taking this healthcare delivery to the needy people who currently do not have that access to quality healthcare right now. So currently, if you see the demographic statistics, more than 50% of the Indian population is less than 25 years of age. And almost 65% people are less than 35 years of age. So India today is one of the youngest.
Yeah.
When we look at the other advanced economies like the US or Japan, they have an aging population, so the disease burden is also a little more. But one major problem that we are currently grappling with is the dual disease burden. While we have the traditional, communicable diseases going on, which are still a problem across the country, especially in the rural areas, we are also encountering a new problem, which is the lifestyle disease related healthcare problems, hypertension, diabetes, and so many other problems. If you look at the healthcare statistics, they are alarming. So, out of 10 people, 10 deaths in the country, almost 7 people are dying of non communicable diseases. So, that's a huge problem. And the government has to take the initiative to spruce up the infrastructure. They have to create conditions conducive to fresh investment. Thankfully, the private healthcare providers have risen to the occasion, and they command a large portion of the healthcare delivery, high quality delivery, which is currently taking place in the country. So 80% of the doctors are today operating in the private hospitals, whereas the proportion of beds in the public facilities is much larger, which essentially means that while the public hospitals command more number of beds, the availability of super specialists is extremely low.
Yeah.
And that's where the private industry is actually bridging the gap. There are a lot of investors ready to invest in India. And if the government creates conducive environment for investment in the coming years, one would see a drastic improvement in the infrastructure.